Hi, so my name's Sarb, Clare. I am a consultant in acute medicine and Deputy Medical Director at Sandwell and West Birmingham NHS Trust. And really, I've been scanning for many years, approximately 16 years, 12 of those as a consultant, when really scanning was really not heard of at the front door, at the bedside. So it's been a journey for me to see point of care ultrasound develop from really from nothing to what it is now, which is really and should be a mandated skill for all clinicians, all generalists. My real interest really from a research perspective, and we've done a bit of research in POCUS and COVID-19, which we can talk about a bit later on, but essentially how POCUS was absolutely critical for diagnosis and sort of prognosis in our patients who had the disease.
And for me, my name's Duncan. I'm a registrar in intensive care based in London in the UK. Again, I've been very passionate about POCUS for essentially my whole career so far. I had the privilege of going through City Hospital, working for Dr. Clare, who really championed this for me. So I definitely built upon that as I subsequently went through other specialties and ending up in intensive care. My major interests are really around echocardiography in critical care and advanced hemodynamic monitoring and the application of that in critical care, but also how ultrasound can be applied in out of hospital settings in more remote regions and at things like events and in the wilderness. So those are the key areas that I'm really interested in at the moment.
Yeah, so really the story started, quite a few years ago when, you realise how point of care ultrasound is absolutely critical for patient care, determining the patient journey, and it does save lives. And I've had the privilege to working with Chris, who is incredibly enthusiastic, really driven, and I knew with him that we could then spread this sort of message that everyone should learn this great skill. And we wanted to develop something that colleagues, not just medics, but nurse practitioners and physios, to take out in the field when they're scanning and use it as a source of sort of direction on how to scan, what did this sign mean. And we were really passionate about empowering others with the skill and also inspiring them. This is what you could achieve if you go on to sort of get accreditation in this skill. So, I think for me, it was really, I was also, I was inspired by Chris, but also really about getting that momentum and message across to other colleagues that if we can do it, you can do it as well.
I think for me, in addition to that, I had the luxury when I was more junior in my career of rotating around lots of different specialties. And I really identified how this skill that was being applied in certain areas was really applicable everywhere. And there's no real difference in the technique or in the findings or in really how it can be applied. But it's all about the clinical integration. And based upon where you are, what your specialty is, what your interest is, then your perception and your integration of those findings are going to change. But the fundamentals don't change at all. And so by us identifying that fact, we really wanted to provide a resource for the areas that are less well versed in the use of POCUS. And that's really why it became targeted at any generalist in any place, working in any environment.
I think we wanted to cover, sort of the basics, understanding how to use your machine, to the physics, because that's really important, because then you can get the best sort of quality images possible and understand why you get the images that you do. But we want to cover a whole range from, the sort of standard, echocardiography to thoracic ultrasound, but we want to go beyond that, and cover things like gynecology and musculoskeletal, because we want to reach out to our general practitioner community as well, because this is where POCUS is not used and if it is used, it's used infrequently, and it's sort of developed, and it's quite established in the hospital environment. But we want to push beyond those barriers, and also we want to hit sort of the undergraduate teams as well. We've covered some unique areas, and I'll talk about a couple of them. And one of them is palliative care, and that's really important because ultrasound can alleviate pain and diagnose the symptomology of patients who are in their last sort of months or weeks, and that's key. And something that palliative care clinicians don't use. So we're really keen that we spread the message there. And hospital at home, where we're passionate about delivering ultrasound in the patient's environment, so they don't have to move to an acute hospital to get their diagnostic. And we're doing a project and piece of work at the moment where we're delivering point-of-care ultrasound with an acute physician and point-of-care bloods to the patient in the home environment to give them the best quality patient journey. And I'll hand you over to Chris, who'll talk about a few other areas that we've touched on.
Yeah, so we really did reach out to lots of other people to see what people thought about what we should include. And we're more than acutely aware of the fact that we work in very much our own domains, and asking other people what they would like. And that's where some of the areas that we were less familiar with, such as musculoskeletal and obstetrics and gynecology, came in because particularly the general practitioners were exceptionally enthusiastic about that being included. Some of the other interesting areas are really what I touched on earlier about how ultrasound can be applied in the pre-hospital, wilderness, austere medicine, and military medicine, and also for humanitarian aid. With the advent of increasingly portable devices, it's definitely an area that's going to dramatically expand in the coming years. And there's really no training that's delivered to these people, and there's no real resources. And we really did want to provide people with a resource to see how that could be integrated, and just to provide some structure for these people for their education.
I mean, this book really is aimed for those who've never picked up a probe before, to those who already, scan, to even those who are in an advanced level. So a real wide spectrum of clinicians, who've, as I said, who are either ultrasound naive or who are really in their accreditation journey. So a wide spectrum of sort of audience out there, because we just didn't want this to be a basic book. It touches lots of things such as volume status and so forth, and Chris can expand on that.
There's quite a lot of resources available for very basic ultrasound and people starting their journey, and I definitely found, having started my journey more recently, that transition between very basic scanning and then more advanced scanning, there was nothing really in the middle. And I was really struggling to find good resources, and I had to rely heavily on my mentors to guide me through that process. And so that really resonated with me, and it made me really strongly advocate for having more advanced features in the book. I think the additional thing is that most accreditation pathways really focus on one or two organ systems, or very basic multi-system approaches. So for anyone who's interested in ultrasound, or who has become very proficient in one area of ultrasound, this will still provide them with a really good knowledge that they can subsequently apply to their practice. We definitely learned quite a lot through this process as well. We learned about things that we don't normally use on a regular basis, and we are huge advocates of ultrasound. I'm not saying that we're experts per se, but in everything. But we have definitely learned a huge amount during this, and I think that kind of shows that there's probably something in there for everyone. We've already discussed how we really wanted to target these markets outside of the hospital. Sarb's talked about the hospital at home project, the palliative care, and then there's a chapter all dedicated towards acute care in out of hospital settings, particularly in pre-hospital, in austere environments, resource limited environments, humanitarian and for humanitarian aid. The other key area that I think is really important to touch upon is the general practitioner market here, and that would be the family physician in the United States. Over the past few years, we've done quite a lot of talks at various conferences and done some webinars, particularly in the recent months. And repeatedly, the people asking how they can become involved in this, where the resources are always the general practitioners. They're a key area where they have very limited resources, where actually they can dramatically enhance their diagnostic potential by having a very cheap portable ultrasound machine, and will alleviate some of their diagnostic uncertainty, particularly about key acute things. So I know that there is an ongoing project about trying to bring an accreditation pathway in the UK for the general practitioners. But this was definitely a market that we were very keen to explore because in acute environments, we already have most of the toys available, but it's targeting those areas where it can really enact a difference that we were enthusiastic about.
I mean, I think what we're incredibly proud of is that all the resources, the videos, the patient stories, so that we have lots of case stories and studies within the book. They're all our own, and which then sort of portrays how critical this skill is required. So we're incredibly proud that all these cases demonstrate the pathology that we want to share with colleagues. And essentially, with the book, that you'll have access to the online videos, which will then enable you to be able to learn and understand what we're trying to teach and trying to share with you.
I think in addition to that, an ultrasound is a dynamic thing. It's a moving image. You see inside of you get a snapshot of inside the person's body, but it's all dynamic, and you see how things interact between one another. And I think that's the really important thing about ultrasound, is that you need to have the moving pictures. So it was really important for us wherever this was published or whoever this was published with, that we were able to provide that facility to have moving images which directly relate to the book as well. And we've got some additional videos in there as well, some very short tutorial videos for certain things that are quite difficult to explain just in text alone, just to clarify understanding.
Yes, I mean, as we know, COVID-19 is really hit us all, and it's been absolutely dreadful, and we've lost so many patients and colleagues during this dreadful time. But what ultrasound has done is it's really exemplified the need for it, and we learned from our colleagues before we had our wave in the UK, from Italy and China, where they started using ultrasound to diagnose COVID with just sort of a simple lung ultrasound. And so when it arrived, we were ready because we already had the skills. So for us, it was about diagnosis, and you could easily pick up diagnosis of COVID. And it was also about prognosis, in the sense of you could, tell who was really sick and who needed, to have a CT scan, who could go to ITU. But it wasn't just lung ultrasound. It was echocardiography, looking for pulmonary embolism, which is a complication of COVID, as well as DVTs. So I feel what COVID-19 has done for ultrasound is it's exemplified how essentially critical this skill is, and what it required. I mean, lots of people learned ultrasound very quickly. The other thing I just wanted to make a note is that the portability of ultrasound was absolutely vital, because it meant that we weren't spreading the infection across the hospital. We were bringing diagnostics to the patient, which again is important for the patient, because the patient was seeing us scanning their lungs, so they could see, what was going on. Because remember, they never had any relatives or any of their loved ones being with them, and the only interaction they were having was with us. So it's been an absolutely core thing, to exemplify the need, and hence we've got a chapter wholly dedicated to COVID-19, what you will see on diagnosis, what happens with the complications, and then if patients go on to ITU as well. So I'll hand you over to Chris, who will tell you more about that.
From a critical care perspective, we were less involved in the initial diagnostic process because we were often very much delivered the patients after a lot of the interventions had been done, but they were with us for quite some period of time. And COVID really was a multi-system disorder, whereas in acute medicine, it was all about prognostication and diagnosis. For us, it was more about identification and management of complications, particularly complications of mandatory ventilation, which all of our patients were receiving at some point. Identifying other organ complications, so using echocardiography, using venous ultrasound to identify clots, and also really just to make our procedures that we do safer. We were able to really efficiently perform central venous access with ultrasound guidance in a patient population who complications would have been disastrous. And we could also determine whether or not to prone patients based on their lung ultrasound, based on whether they had any consolidation or whether they had just a typical B-line pattern. So I think it was essential. We had dramatically expanded intensive care units. Our resources were all extremely stretched. The people who potentially we would send for a CT scan, we didn't necessarily have the resources available to do so. So whilst these people did get the investigations that were required, we were able to ensure there was no dramatic things that we needed to identify rapidly using ultrasound. So it was extremely important. And again, many of the skeptical intensive care clinicians became advocates of ultrasound after the pandemic. So I think it definitely moved the whole thing forwards.
We've got a couple of additional chapters. The first one is all about governance and quality assurance. And what you often find is that no one really talks about that, but it's actually fundamental when you're delivering ultrasound and skilling up in it. It's about knowing your limitations, to knowing why you can't get the image the way it should look like. It's about auditing and making sure you're safe, because it's all about getting the best quality images, interpreting them for our patients. So we've got a whole chapter on why it's important that we have a good sort of governance structure and quality assurance. And we have a great chapter on all the training and accreditation that is out there, not just within the UK, but throughout the world, which is fantastic to see so many accreditation pathways that can be accessed.
Well, thank you everyone for watching. This book should be available at the beginning of December of this year, 2021. And it is available for pre-order now on the Cambridge Core website, which I believe there's going to be a link at the end of this. You can also access information about the book on our website called www.generalistultrasound.com, which also has some other interesting cases and some stuff about accreditation and a reporting tool that could be of use to people. So thank you very much for listening, and hope you enjoy.